Good evening and welcome to I'm Listening Live. I'm Listening is a 24/7, 365 initiative that works to let you know that we are here, we are listening, and also that we need to normalize talking about mental health. The holidays are coming. Now, we got to have a conversation because the holidays have to be different this year. The public health professionals are reminding us that it is safest if we stay home. So I'm urging everyone to please get comfortable and confident in having holidays different this year. Now remember, different doesn't mean bad, different doesn't mean broken, different doesn't mean canceled. It just means it might not look the way that it's always looked. For those that feel as though it's going to be too depressing and anxiety-inducing to still celebrate, that's okay. You can take the time off, the day off. You can postpone it till next year. But I am recommending for those that feel up for it, still celebrate somehow, still get dressed, still make your favorite foods, listen to the music, make your place decorated. We can still engage it. It just has to be different. We're going on Skype and FaceTime and we're celebrating. So have the holiday, but make it in a safer way. And please, please, please check in on those around you. There's many people that are isolated, they are lonely, and they are not traveling this year, and they're taking it very hard. So check in on those around you. You might be sending a text message that actually saves someone's life. Now we're going to go to our first guest, Dr. Bhuvana Rao. So how are you first off? How's your mental health doing through all of this?
Well, thank you for this opportunity and thank you for asking. I'm doing well under the circumstances. Some days are better than others, and I try and practice a little bit of self-care on a daily basis to keep me mentally well.
Self-care is the important buzzword these days. I think I say that probably to about 12 to 15 people every single day, right? We're trying to stay as resilient as we can. So I looked at a study and I wanted you to kind of unpack this with me. And it was saying that, we're at a 20-year low in terms of mental health functioning. Do you think that that is all COVID related? And if so, what do you think have been the most important parts of COVID that have been maybe negatively impacting our mental health?
Sure. Yeah. There's so many stressors in society, generally speaking, for our youth, for our general population and, our workforce. And particularly now with COVID, we're finding that mental wellness is really on the forefront. We need to highlight mental wellness. People are feeling very stressed, understandably so, because there is a pandemic, there's a lockdown, we're not able to be with our loved ones. There is a lot of sickness, there's a tremendous amount of anguish. Many of us personally have experienced either the disease or loved ones who have suffered and are dying from the disease. And we have a very difficult, climate in general with a very polarized community. So there are so many stressors that are right now prevailing that are creating a lot of stress in people's lives. And so, needless to say, mentally, it is impacting people in a negative way with their mental wellness.
And I know culturally we are confident and happy to legitimize physical health and physical impairment. Mental health is something that we're still working on building confidence talking about. I think that's the one positive thing I want to come out of COVID is more recognition on mental health and mental well-being, as you said. One of the things we don't confidently talk enough about, and I think we have to start, is suicide. I think that word is hard for many to say or many to even use as a way to check in on those around them. How do we start to normalize that discussion?
Yeah, I'm so glad you asked that question. The key operative word is normalizing that discussion, like you rightly pointed out. I think in our society, we have focused so much on, the physical well-being. It's a very image-focused society. And so if there are things that people are experiencing that have to do with mental illness, then those are typically stigmatized. Our society has tended to stigmatize mental health issues in general. And suicide is the really something that we find that people are not very comfortable talking about. And so this is something that we really want to emphasize and encourage in the field of behavioral health, that there should be no shame in talking about how you're feeling. Your emotional wellness is as, if not more important than your physical well-being.
100%. And it's so fascinating just being out in the world myself, where if I try to practice that and try to be part of normalizing, and I discuss, maybe I'll say I had a hard day today, I was a little anxious or had some depression. It's fascinating to see how people get very uncomfortable with those topics. So it reminds us how much work there is to be done. So in terms of mental wellness and suicide prevention, what are some of the key factors that a loved one would want to look for to indicate that maybe they need to talk to someone about their possible suicidality?
Right. I think the first thing is to be very patient with your loved one. Just sit down, reach out to them, express your concern, be genuine in how you're reaching out to them. Look for warning signs. There are always, when somebody has contemplated suicide, you'll see that there are a lot of warning signs prevailing. And time and again, lost survivors have mentioned, I wish I had known about this. Look for signs such as people will talk about, ways to end their lives. They will talk about, or they would maybe increase their alcohol or drug use. They will express the feeling of hopelessness, desperation. You might find they're giving away their belongings. You might find they put their affairs in order. There might be reckless behavior. Change in sleep patterns, mood changes. There might be a lack of sense of purpose. Oftentimes they talk about being a burden to others. So there are many things, these warning signs that I just listed, you'll find if you pay attention. The first step, of course, is to reach out to your loved one, be there in a very non-judgmental way. For them, sit down, listen to them, make contact, and actually have an honest conversation with them about how they're feeling.
I love that. Make contact and have an honest conversation about how they're feeling. I think some people are worried that if they bring certain topics up, that somehow it's bringing it into reality or supporting it. And would you agree that no, in fact, sometimes we need a loved one to approach us and say, are you thinking about this, that, are you struggling, correct?
You're on point. Absolutely. It is really a myth that we really need to bust out there, that talking about suicide puts ideas in people's head. This is a myth. In fact, if we are open to talking about suicide concerns openly and honestly with our loved ones, then more often than not, you'll notice that they are actually really seeking that hand, that helping hand, that hand that reaches out to them, because you're showing concern. You're understanding that they are experiencing deep emotional pain. People who have considered suicide, they don't want to die. They want to end their pain.
Beautifully said.
Starting that conversation really is the first step.
And I know that you and the OC are working on a phenomenal campaign. Tell our listeners a little bit about that.
So I'm really excited you asked me about this campaign. I would encourage your listeners to go to helpishereoc.com. This campaign is a suicide prevention awareness campaign that encourages those who might be struggling with their mental health or thinking about suicide to really reach out for help. At this website, we encourage people to get familiar with the warning signs, and we have plenty of helpful resources, including a lot of links to local support services.
Beautiful. Thank you for the work you're doing, Dr. Bhuvana Rao. Have a beautiful holiday, and thank you for being a part of our show.
Thank you very much for having me here.
Have a great rest of your night. And there it is. We're trying to remind everyone you want to normalize talking to those around you about your mental health. And so part of doing that is not just saying to someone, how are you doing, but actually saying, how is your mental health? That lets people know that you are a safe person they can talk to about their mental health, but also reminding people that it's important to prioritize it. And as always, I also want to remind everyone, check in on those around you. There's a lot of people that are dealing with isolation and loneliness, and it's really important for them to know that there is someone there. All right, now we're going to go to our next guest, Katie Morton, licensed therapist. Katie, how are you?
I'm doing okay, hanging in there. How about you?
Doing the best we can. Not ideal, but 60% is good enough, right?
Agreed. Right now it's just surviving,
100%. So I wanted to talk a little bit about the impact that COVID's having on people's relationship to their bodies and food. And I was looking at some studies by NEDA, the National Eating Disorders Association. They said, based on their research, 72% increase in the discussion around people struggling with their relationship with their bodies. Talk to us a little bit about what that means.
Yeah, I think the problem with having more time on our hands and having time for, a lot of people are like, oh, we have time for introspection. For those of us who struggle with any mental health issue, but specifically one with our bodies, this can be really difficult, not to mention the fact that now we're rolling into holidays. And that food it's already a very triggering time. But I mean, think back to the beginning of quarantine. A lot of people were talking about sourdough bread and banana bread and making food. And people were, even personally, I ordered what I thought was 1 box of brownies from Costco. Big mistake. It was like 6, and you're like, geez, what do I do with all of this? And that's really triggering for both my patients who are under eaters, like more of the anorexic type of a person with an eating disorder, all the way into my binge eaters. It can be triggering for all of us because we have that time on our hands, and eating disorder is a way to cope with stress and upset. Guess what? We're stressed and upset. Therefore, it makes total sense that NEDA found out, that's what the study showed.
And it's hard to get a break away from it. I've been really good about unfollowing things that pull me back into an assessment of, my own body and what I'm eating. But it keeps popping up. Like I keep seeing, of course, the COVID-15 talk. God bless her, Lizzo is back in the news because she went on some kind of juice cleanse. So what do you say to people? Like, what is the best expectation someone can have for themselves right now in trying to take care of themselves? Is it about just shutting down all social media? What should we be looking at?
I mean, I think it is important, like you said, to take stock of who we're following and make sure that it's things that, and pun intended, kind of, that feeds us healthfully, right? It needs to be something that's good. We want to make sure we're taking in good social media. And if it's not helpful and it's actually harming our mental health or our recovery, then it's a time to, mute and unfollow people with ease. I don't think this should be something that's guilt-ridden. I think we should all be doing that. But I also think it's important for us to make sure we have extra support during this time. Like I said, I'm just surviving. I know some people are thriving, but we don't need to compare. Right now is a time to, how am I doing? Am I taking care of my basic needs? Like sometimes we just have to go back to that. Am I, getting enough sleep? Am I drinking enough water? Am I seeing my therapist regularly? Taking my prescribed medication as needed? Like all of those things are really key right now because we're already super stressed. There's so much going on in our world. Just know that it's okay to disconnect and to get back in touch with yourself and your support system. And I would encourage everyone to do that.
Beautifully said. Now, I know working with some of patients in my practice, we're talking about their relationship to things like drugs and alcohol. And it's been hard for them to really assess what is a sign of like too much downtime or not working or being stressed versus I have a problem or I'm walking myself into one. So when we're talking about someone's eating patterns and habits, if at all, how should they be assessing whether or not they need to reach out for help versus just maybe poor coping?
Yeah, that's a great question. The truth is, if you find most of your brain space taken up with thoughts of food, either getting food, eating food, getting rid of food, earning food, because we don't talk enough about how people feel like we have to earn it. Like, oh, this is my cheat day. We need to get away from language like that. Every day is a day where I get to feed my body what I want, eat when I'm hungry, stop when I'm full. And so if we find our entire day and our entire brain filled with thoughts of this, of food, exercise, and things like that, then it's a problem. I know in like when it comes to diagnostics, we always say, is it impairing our level of functioning? And I believe if our thoughts are filled with that, we don't have room for any other thoughts, and therefore it is impairing us.
Okay. And then let's talk quickly just about the holidays for those that are traveling. God bless. We'll leave the whole COVID perspective out for a second. If someone's aware that they're going to be entering an environment where maybe friends or family members might be commenting on their body, weight gain, weight loss, what they're eating, what kind of steps should they take beforehand or while there to protect themselves in terms of mental health?
Yeah, there's a couple of things we can do. First of all, preparing ahead is always key. It's like setting ourselves up for success, right? We don't want to just run in towards this really difficult and potentially triggering situation. So putting a plan in place, I always try to put, I call them like safety plans with my patients. And these can be anything from bringing a supportive person with you. Again, we're kind of leaving COVID out of this,
Right.
but having someone, a spouse, another family member, someone who knows and gets it and is supportive of you, having them with you. That's great. Also, if you have an opportunity to have conversations ahead of time with loved ones, do that. And you can even have an advocate. Like if your mom is super supportive or your sister, brother, whoever, letting them know and then letting them talk to other people. You don't always have to do all the heavy lifting, but letting people know and giving them an opportunity to be supportive. I find most of the time, again, not all the time, but most of the time, family members just don't realize. They don't know how upsetting it is. They don't know what, oh, you look great or healthy can mean to someone who has just gone through recovery and has gained weight and is feeling that. We can take that compliment and turn it into an insult, right? And so just letting people know what's okay and not okay ahead of time is great. And then also just knowing that you have some coping skills on board. Like, is it, I'm only going to do this one meal with this family for this amount of time? It's okay to set healthy boundaries around that, because then I need to go back home. I need to journal. I need to talk to my therapist or my best friend. I need to call, cope, because even if they don't listen, let's say, and it is still triggering, we need to have ways that we can manage. And it's okay to have, we need to have things that we can do in the moment, but also after the fact. And just making sure we've prepared for that ahead of time will really set you up for success and help you get through it as unscathed as possible.
Unscathed as possible. Yeah, planning is so empowering. And I like what you said about how have a little compassion, because some of those comments about people's weight gain or loss is so normalized in our culture that not everyone's aware that it can trigger someone, or maybe it might be something that trigger someone, or makes them feel bad. So I like holding space for that. And also I'm trying to remind everyone that the holidays are supposed to be fun, and your fun and your comfort matters too. And sometimes that might mean setting a boundary or even not going.
Yeah, exactly. And that's something I've been talking a lot about recently is boundary setting and expectation managing, because this year is a little bit different. And I love to tell people the best way to kind of set a boundary, because people think it means we're going to potentially fight or we're being aggressive. And no, it's clear communication and asserting ourselves, well. And it's best done what I call like a hug and roll, where we're like, Mom, I love you. Thank you so much for inviting me to that. This means the world. The holidays are my favorite time. However, now is not the year where I can come, and I hope that you understand why I have to make that decision. Those are ways that we can try to communicate with a love up front, and then, a clear understanding of what's okay and what's not okay.
Yeah, I love that. That felt good to me as you said that. So
Okay, good.
Yeah, totally. And also remind people that, unfortunately, not everyone's going to say, thank you for setting a boundary. I'll honor that. You have to kind of set it and hold it anyway. And that, we're trying to get people more familiar with boundaries being set, but not everyone's going to honor it. So you got to kind of hold it anyway.
Yeah, we can't control other people. We can only control ourselves, right? And we might have to be a broken record, but we do that to take care of ourselves.
Beautiful. Katie Morton, thank you so much for being a part of our show. Have a great rest of your night.
Yeah, you too. Thank you.
Of course, be well. And that's what it's going to be about. Surviving the holidays in terms of centering and prioritizing our mental health is often going to mean having a plan ahead of time, knowing that your needs are going to get met, practicing setting those boundaries maybe before you actually arrive. And also sometimes it means missing out, but your mental health matters as much as your physical health. So please prioritize that. For those that need a little extra support, we're going to put some resources up at the end of our show. And if you want to check out past episodes of I'm Listening Live, you can go to alltheradio.com handles. They're all posted there. As always, thanks for hanging out, and you have a beautiful, beautiful rest of your night.